Good afternoon, everyone, and thank you for joining us for the weekly seminar. Despite the fact that summer is already started and people are away or busy closing the year, we have participants online, so please I invite them to write any questions in the chat. We will be monitoring them throughout the seminar, and hopefully the speakers will be able to answer at the end. It is a great pleasure today to, first of all, be volunteered by Salim and Samar to facilitate the seminar, since Salim won't be here with us for the whole time. And it's a special privilege because it is a very timely seminar after the conference we just held at AUB on justice for Gaza. So we're here today to learn about the work of the Institute for Palestinian Studies, the great work they are doing in documenting the systematic destruction of the health sector in Gaza, among other things. And I'm very pleased to welcome our two distinguished speakers, Mr. Rami Rayess and Dr. Layth Hanbali. And we will divide the presentations into two parts. First with Mr. Rami Rayess. Rami is the Lebanon Director for IPS, the Institute for Palestinian Studies, in the Beirut office. He holds a master's degree in political science from the American University of Beirut. He is a journalist who writes in English, Arabic, and French in several local Lebanese and regional newspapers and outlets, and had previously served as editor-in-chief of numerous publications. He also worked as a university instructor and translator. His first published book in Arabic in 2020 is entitled Readings in Crises of Lebanon and the Region, and I'm sure it's still very timely given that we're not ending crises in Lebanon and the region. So Rami, thank you for being with us today, and the floor is yours.
Thank you, Martin. Thank you for attending, and salutes as well to the people who are following us on Zoom. And I'm gladly joining today to talk about IPS, the Institute of Palestine Studies, which is also a timely event, as Martin said, after the important conference that was held last week at AUB, and because of the ongoing genocide, if I may say, in Gaza and the Palestinian occupied territories. The Institute for Palestine Studies is actually the oldest institute in the world devoted exclusively to the study of the Palestinian question and the Arab-Israeli conflict. It is devoted to publishing research, analysis, and documentation in all the different aspects of the conflict. The IPS was established in 1963, so it is quite old, by three scholars, Constantin Zre. Thank you, Huda, for being with us today. We all miss him dearly. And Walid Al-Khalidi, who is still alive between us and still writing and publishing, actually, and the late Burhan Dajjani, who was also the third of the three who established the institute in 1963. IPS is a non-partisan, independent, non-profit research institute. It is not affiliated with any political party, with any government, neither in Lebanon, nor in the Arab region, nor in the world. And I assume you know that being fully independent at the scholarly level in our region is quite a challenge. So we have faced this challenge throughout the decades, and we are always keen on preserving it as well. It is led by a board of trustees composed of scholars, businesswomen and men, public figures from across the Arab world, and by a volunteer executive committee elected by the board. IPS has three offices. One, the headquarters, which is in Beirut. And here you can see our location. We are located in Verdun. We have an 8-story building, which includes all the different departments of IPS. We have an office in Ramallah and a third office in Washington. And we used to have an office in Paris. Unfortunately, some of the financial difficulties led to its closure. Now we are contemplating the possibility of opening it again. We have the Konstantin's Center for Information and Documentation. It's the Institute's library and archive departments. It has more than 80,000 volumes in English, Arabic, French, and even Spanish and Hebrew as well. We have some Hebrew references as well. And it holds a valuable collection of Palestinian newspapers and periodicals issued before the Nakba, as well as posters and out-of-print newspapers from the occupied territories, the Arab world, and elsewhere. So we consider that the Konstantin's Library is the largest library in the world devoted to the Palestinian issue and the Arab-Israeli conflict. And we do possess a large number of references and resources which are not available elsewhere. So this library is available at the disposal of all scholars, researchers, students, and all the people who are interested to learn more about the conflict. We have the catalog. It's online, not the books. The books are not online, but the catalog is online. So any researcher can go browse through our website, the catalog, and check the references he or she needs, send an email to the library, and they will be prepared. We have a study area with Wi-Fi and photocopy and all the services. Someone can go on a daily basis to make use of the references. Unfortunately, without having the possibility of borrowing them outside the institute, because for logistic reasons we cannot. I mean, we're not like universities. We cannot follow up on those who take the books. So we keep them in-house. And the IPS publishes 3 journals, actually, 2 in Arabic and 1 in English. I'm sorry, 2 in English and 1 in Arabic. Journal of Palestine Studies, Jerusalem Quarterly, and مجلة دراسات فلسطينية. They are peer-reviewed and they are edited in Washington, Ramallah, and Beirut. They publish peer-reviewed academic articles in addition to reports, interviews, book reviews, and other material. IPS has published more than 800 books since its establishment in English, Arabic, French, and Spanish. Some of the Institute books are used for teaching courses about Palestine in several reputable universities. Of course, some of the books are out of print, but many other books are still available for those of you who want to read our books. We have several digital projects. This was an attempt to follow up or to, if I may say, match the technological revolution which we are all living. So we produced a very important platform, which is the interactive Encyclopedia of the Palestine Question, palquest.org. It is more than a million-word online encyclopedia that covers the history of Palestine from the 16th century until today. And it is searchable and very easily accessed, and it can give information for those interested on the various topics from that sense. We have the Palestine chronology since 1982, the Congressional Monitor, and the Monitor of Israeli Imperialism and the Policies of Apartheid, which is a monthly bilingual report that handles all the policies which are done by the Israelis as an apartheid state, and the things on the ground and the legislations and all the other actions. We have a daily newsletter which summarizes the most important news and statements and analyses of senior political and military analysts inside Israel in the Israeli press. It's published in Arabic on a daily basis. It's called Selections from the Hebrew Press. Anyone who is interested to receive this on the email can just send us, and we will add him to the mailing list. It gives a very good idea about how the Israelis are thinking and how they are tackling the issues. And we have the Palestine Social History Archives and documentation of the healthcare system in the Gaza Strip, which my colleague Layth will talk about. We have an art endowment project. This was an attempt that we embarked on a couple of years ago in an attempt to diversify the financial resources of the Institute to sustain our academic integrity and independence. And this has been quite a challenging project. We approached more than 800 artists from around the world who contributed paintings to IPS into this art endowment project, and this has of course increased the portfolio of the IPS, and this will be used gradually for financing our publishing system projects, and at the same time, as I said, to sustain for the future, for future generations, financing for IPS. I'm sorry, I'm forgetting to move the. Okay. Okay, so IPS has been for more than half a century striving to give the real narrative of the conflict, and this has been quite difficult, taking into consideration that the other stakeholders also have their means of deviating the truth, but we are doing our best based on the research criteria. Of course, we are present on social media with all the platforms: Instagram, Facebook, X, LinkedIn, YouTube. We're even on TikTok recently because this has proved to be also an active way, especially for the youth, and Telegram and WhatsApp and all the other things. Now, I will just say a few words before I leave the floor to my colleague Layth. After the October 7, of course, it was a turning point, not only in the history of the conflict, if I may say, but also for us as a research center. So we were trying to find the best ways of giving the necessary information for the public opinion, for the researchers, for the media about the conflict, how it's ongoing, and of the historical roots of the conflicts as well. So it was quite a challenging period. So we tried to find a way where IPS could be part of this effort, yet not become a media institute. We are not a media institute. So we published policy papers, more than 85 policy papers since October 7 have been published. 70 of them have been produced in one huge volume book, and they cover all the aspects of the conflict. We also tried to seek quick videos from analysts, researchers, 2 to 3 minute videos, each one giving his or her input about the flow of the conflict, how it was going. Of course, we have the Nashra, which I talked about earlier. It was produced 7 days a week to portray the Israeli viewpoint. We organized tens of dialogues, seminars, lectures online, and actuals on the different topics as well. And we published as well more than 200 articles in Arabic and 135 articles in English and 44 articles in French from contributions from writers from around the world about different aspects of the conflict in our blog. And this also contributed to giving more explanation about how the conflict is going. And the policy papers, I talked about it. I also talked about this monitor, which was very, very important and very timely, because it proves that the current conflict stems way back, and it's related to different aspects of the war. We also have a very important project. Layth will talk about it, the documentation of the destruction of the healthcare system. And we also launched 3 parallel projects parallel to Layth's work, which are documentation of the destruction of the education, agriculture, and cultural sectors. Of course, you know how universities were and schools were all destructed in this war. And now we have a generation of students who have been out of school, out of universities for this full academic year. And if the war stops now, there's nowhere they can study starting next year. This is a big knowledge gap which we will have for this generation. We are preparing for an art exhibition, a very silent art exhibition, if I may say, in support of Gaza in IPS Beirut, starting next July. So I will stop here, and I'll give the floor to Layth, and thank you for listening.
Thank you, Rami, for a brief and yet very informative presentation on IPS. I think we'll leave all the questions till the end for the sake of time. Now it is my pleasure to introduce Dr. Layth Hanbali, who is a health researcher at IPS. And he's a researcher at the Institute of Community and Public Health at Birzeit University. At IPS, Layth is coordinating the project to document the targeting and destruction of the health sector in the Gaza Strip during the genocide. He has also worked as a public health practitioner and physician. He earned a master's degree in health policy planning and financing from the London School of Economics and Political Science and the London School of Hygiene and Tropical Medicine, and a medical degree and a bachelor's degree in global health from University College London. Layth, the floor is yours.
Thank you so much. I've got this, so it's okay actually. Yeah. Thank you so much. Good afternoon, everyone here and online. It's I think very important to be here. Sometimes it's hard to place the right word, and I think it's not a pleasure to be talking about this. And so I think we should be clear about that. But it's certainly an honor to be here and to speak to you, and to have worked to coordinate this project in which we document the targeting and destruction of the health sector in the Gaza Strip. And in this project, we contextualize the project within the broader Zionist strategy of dismantling entirely the lifelines that sustain the people of Gaza and the prolonged processes of suffocation that Gaza has endured during the siege, but also decades of colonialism and occupation. So we really aim, and it's very important to always put this at the forefront, as Rami has also alluded to, and highlight that the genocidal war is not an isolated event, but a calculated continuation of Zionist colonialism's necropolitics, the policies of death that the Zionist colonialism, that all colonialism systems impose on colonized subjects. So it's important here that we also emphasize not just the colonizer's perspective, but also the colonized resistance and the elements of resilience in the pre-existing emergency response healthcare structures, which are the ways in which people of Gaza have tried to resist and reaffirm their insistence on life in opposition to these policies of necropolitics. So obviously there is no question that the current genocidal attack and the targeting and destruction, not just of the health sector, but also of all of the other civil infrastructure in Gaza, really represent a rupture and a truly kind of horrific, unprecedented attack on the most essential services that sustain life. But it's also undeniable that they're part of that broader aim to suffocate the Gazan body and maim the structures that sustain and produce life, as part of a broader strategy to make the Gaza Strip, but also elsewhere in Palestine, unlivable for Palestinians, with the aim of driving them off their land. And when we put it like that, then everything that has happened since the Zionist Congress of 1897 is perfectly explicable through that lens. And so we quickly come to understand that the current genocidal war represents a continuation of the Zionist colonial strategies of ethnic cleansing, and that and it's important as part of that to also recognize the broader kind of global implications of this, because the rupture that we see within the current genocidal war is not just a rupture in Palestine, but it's also a rupture that is taking place at a global level. And so the fact that every single hospital in Gaza has either been damaged through bombardment or through shootings or besiegement, incineration in the case of a Shifa hospital, or being put out of service due to lack of fuel or medical supplies, and the fact that 500 health professionals have been martyred, the fact that over 300 have been abducted, the fact that dozens more have been disappeared, and that some of those who were disappeared or abducted, at least two of whom, Dr. Adnan al-Bursh and Dr. Iyad Rantisi, were unfortunately killed during torture during their abduction, that all of those things represent not just a rupture in Palestine, but a global rupture. And I'll come to that later. So the targeting of the healthcare sector, it's important to note, is not only about the direct physical destruction of the infrastructure, because it's also about asserting sovereignty, Zionist Israeli sovereignty, over the Palestinian body, but also over international structures, over international norms, over international law, that there is a supremacy of the tactical decisions of the Zionist army over any previous norms that we thought applied when there was any kind of occupation or violent control of a population. And we know, obviously, that death and violence are foundational to Zionist sovereignty, but the ultimate power or the ultimate, shall we say, theater in which they exercise that power is by dictating and essentially owning the death of Palestinians. And so this is how the colonial occupation aims to create what Achille Mbembe, the Cameroonian philosopher, described as the death world, in which people live in a state of limbo between life and death, or even a prolonged form of living death. And this is a policy that the Zionist occupation aims to institute for decades to come, not just in a single event. And so the occupation forces always try to achieve during ceasefires what they're unable to complete during the times of clashes and the times of war. And that happens by the manufacturing, the establishment of what is called a war biosphere. And so it's not just the targeting of hospitals, of health professionals, of health personnel, of clinics, but it's also anything that can sustain life. Because as we know, and I think I don't need to talk to an AUB audience about this, we know how it is the structural elements that determine health first and foremost. We can almost think of hospitals as decoration to all of that. It's that much of an important distinction to make. Now, in addition to creating the war biosphere, necropolitical regimes also use spatial fragmentation as a technology of control. And so the creation of spaces of exception and siege, where the state suspends the law and the prohibition on murder, is extended to the places that are supposed to sustain life. Healthcare facilities. That's the exception here. That's pushing the state of exception that the Zionist occupation has always been able to do, and that it has done over decades and decades. And so during the ongoing genocide, the Zionist military institution has really replicated and epitomized that these kinds of policies in the spaces that foster and reproduce life more than anywhere else. And that's an important distinction here. And so that's why documenting the chronology of attacks on hospitals becomes a really central component of documenting the targeting and destruction of the health sector. So we need to just kind of be really clear on where that importance lies. So that targeting has become a spectacle. The targeting of hospitals and health facilities is a way for the Israeli forces to display and create those spaces of exception. And that relates back to the sovereignty, to the control that Israel aims to institute through its necropolitics and through its necropower. And so by the very fact that these structures exist and continue to try to sustain life, we can see that they are structures that resist the death that is imposed by Israel. And so they are part of an infrastructure of resistance. The same obviously goes for basic infrastructure, electricity. We saw the water engineers that were assassinated the other day. We saw schools being targeted. It's because they are all part of that infrastructure of resistance. But it is the spectacle of targeting hospitals that is important to highlight here. And so before kind of talking more about the aims and the methods of this project, I will just quickly point to a rich history of the role of medical resistance in the Palestinian struggle, in the Palestinian liberation movement. And many of you may not know, many people know that George Habash was a doctor because he's colloquially called Al-Hakim, but not many people know that Wadi' Haddad was also a doctor. They studied together here, actually. And then one of their very first political activities was to move to Amman in 1952 and establish a clinic as a front for their political mobilization of the Palestinian masses and to provide services to poor people in Amman, whether they're Palestinian refugees or other marginalized groups. In Amman, we also saw, or in Jordan in general, we saw the establishment of the Palestinian Red Crescent, which then moved its operations predominantly to Lebanon, which dubbed itself very clearly the companion of the Palestinian Revolution, Rafiq al-Thawra al-Palestiniya. We saw the resilience of the medical workforce then during the al-Za'atar massacre and many other massacres that occurred in Lebanon, but then also then within the Palestinian territories themselves with the establishment of health committees such as the Palestinian Medical Relief Society and the health work committees just before the first Intifada, again forming what was then termed at the time an infrastructure of resistance. So here we turn to Gaza, and the history of healthcare in Gaza is at least equally impressive, because out of 40 hospitals in Gaza, 3 were built during the ongoing genocide, field hospitals. 13 were built during the Intifadas, the first and the second Intifada, and 13 were built since the siege started in 2007. So the vast majority of medical infrastructure in Gaza was built during some of the most violent times. And so documenting the history of the healthcare sector has formed a really key part of our project to help us understand the unique role of medical resistance as a central part of the Palestinian question, which explains why it is then chosen as that place for the spectacle. And so one of the aims of the project, and this is one of the first things we actually did when we started the project, was to document the pre-existing structures that were established in Gaza before the genocidal war. And this is important, obviously, for the Palestinian historical record, but also to understand how Gaza was able to sustain that infrastructure of resistance for any future planning as well. It's important to really understand that history. And so I hope I've convinced you that there is an urgent need to document and publish details of the attacks on the healthcare sector as well, which serve a public use because of the rupture that I talked about, but also for scientific and legal research, and because this really needs to be in the archives from today, because this genocidal war marks such a turning point in the Palestinian question. And as part of our methodology, we also prioritize locally, or are aiming to increasingly prioritize locally produced knowledge to emphasize the importance of the narratives and stories of the healthcare workforce in Gaza themselves, and really highlight their expertise at the front line. So until this point in time, we have focused on secondary data collection methods, and this is to research the attacks on healthcare services, as well as their history. And we've collected public statements, reports, and documents published by organizations that have been active in Gaza, and collected key statistics around the impact, the result of the destruction of the health sector in Gaza. Later on, we will also engage in primary data collection methods to document first-hand accounts through primary interviews with witnesses and survivors, but also to fill gaps that currently exist, to correct the record, because obviously in such a state of emergency, gaps will inevitably also form, and it's really important to always think about that when we're documenting during such a difficult time. And to achieve the aims that we had in the project to highlight medical resistance, it was also important to use a holistic approach that really kind of drew on the pre-existing structures as well, by contextualizing the research on healthcare facilities, including their development. So from the kind of the very start of their conceptualization to their establishment, their funding, and what they went through over time, how they responded to the siege, how they responded to the first and second intifada, and restrictions on resources, etc., etc. So the methodology focuses in all of its forms, so qualitative and quantitative, to center the community voices and narrative of those who are most involved in the delivery and who are most affected by what's going on. And so we try to provide information about victims from the healthcare sector, to include details of their lives and what they contributed, not just circumstances of how they were targeted. And as I mentioned, the fact that we will collect testimonies later on, and also by commissioning writing material from people who are in Gaza or who have just been in Gaza or who are very familiar with the context. So the outputs of this project, and we've published only, or we've kind of achieved only some of this, and this is obviously a work in progress with the continuation of the war. We're constantly updating everything, but what we've this is both what we've achieved and what we've planned, is a public database of healthcare facilities, which includes and I'll show you, we've just launched this only a few days ago. So I'll quickly just point to the elements of the project. So we've launched this online database, which is just in Arabic at the moment, but we're working to edit the texts. They've all been translated to English, but we're in the editing process, so we'll hope to have the English version launched as well. But we have the biggest section where most of the content currently is in the what we press here, منشآت المرافق الصحية, the health facilities, which number 40 hospitals, as I mentioned, and there are almost 100 health centers. And we detail all of them and include details about the kind of metadata of each hospital. This is a Shifa medical complex, which we know is out of service, خارج عن الخدمة. We know various things about it, including who runs it, when it was established, where it is, who runs it, etc. And we highlight here the most prominent targetings and assaults that have taken place through the genocidal war. We go on to describe the services that each health facility provides, as well as a general overview. So we talk about here the establishment of a Shifa hospital in 1946 during the British Mandate, and then the various things the various changes that took place in its structures over the years under Egyptian control, Israeli occupation, and then after the Oslo Accords were signed and the Palestinian Authority took ownership of it, as well as kind of what it was providing previous to the war. We talk about any kind of funding and foundational details that we can find to also highlight the partnerships that a lot of these hospitals had, some of which were kind of very dependent on some kind of neoliberal models of support, whereas others depended on more kind of solidarity based, depending on who, when they were established, who they were established by, etc. We talk about what happened in the facility during the siege, and then an almost daily chronology, as far as we could find, of the narrative during the war. So on the 9th of October, as a result of bombardment in the vicinity of the hospital, the incubator division of the hospital was damaged. On the 18th of October, Al-Shifa Hospital received all of the patients and injured from the bombardment of Al-Ahli Hospital, which massively increased the pressure on the hospital, etc., with sources and links to other parts of the institute that talk about these events. We highlight all the martyrs from the health sector, as well as those who were abducted, those who are missing or who have been disappeared, and those who have been released. And as I said, we talk about not just how people were martyred, but importantly also what they did during their life, what their contributions were, and how they were seen, with obvious highlights that were very important to talk about, such as Allah yarhamu Dr. Adnan al-Bursh, who really had a very remarkable journey, and there is no question about the fact that he was singled out and targeted for abduction, and then was killed during his torture in Ofer prison. We, in addition to that, as I said, secondary data collection that we have carried out over the past 4-5 months, we have also commissioned a series of policy papers and other analytical materials, analytical written materials, in which we try to highlight various important dimensions that we can't talk about just by relaying the events that took place. So talking about the health sector, how it was functioning during the course of the genocide, and about public health, as well as one that Martin kindly contributed to, about the kinds of things that we need to be considering when thinking about the reconstruction of the public health systems in Gaza, drawing on, again, the historical context of the public health structures in the Gaza Strip, as well as many more that are in progress of being commissioned and written. We will, as I mentioned, also have testimonies that we will be including, primary testimonies at the moment. We've only included kind of related testimonies that we can find from secondary sources, but we will also include primary testimonies going forward. And we will also be holding events, whether they're closed workshops, open events, and also culminating, hopefully, in an international conference to bring people together to discuss these issues, because we can't get anywhere by just putting things on paper or online. We need to be constantly discussing these things, hearing the different perspectives, because obviously even within Gaza there are different perspectives, within the whole of Palestine there are different perspectives about trying to understand what has happened in order to make sense of what needs to happen going forward. I will just end by saying that we see very clearly that the targeting and destruction of the health sector in Gaza is unprecedented in scale, as is the genocide as a whole. And I feel it's an important note to end on the challenge that this sets for us collectively. Because if this crime comes to pass the same as other Zionist crimes that have occurred over the decades, it would pave the way for worse atrocities in the future, whether in Palestine or other cities at the peripheries of colonial metropoles that will be turned in the future into carceral spaces in which the populations are deemed surplus, illegal or unwanted, and then the same thing can happen again, or the next war will start where this one ended and then get even worse. So Gaza, we need to understand, points at what is to come. So it is our collective responsibility not just to research and understand these atrocities, but really, really importantly, most importantly, to use the tools of research and the results of our research and understanding to contribute to justice and liberation. Thank you for listening.
Thank you, Dr. Layth, for such an inspiring work. And of course, we can only tell the magnitude of the efforts and the energy that has been put into this, and saying that this is work in progress also requires further energy and effort. So thank you for that. I will open the floor now for questions. We have about 10-15 minutes.
Thank you so much. That was really an excellent presentation, and I really liked your analytical framing of and your public health approach, which you really welcomed. I just have a comment and sort of a question. Ghassan Abu Sitti last week in the conference, when he was asked, what was the most, how could the health system be better prepared for the future for such horrible situations? And one of the comments that he said was that investment in people and training was the most durable. I mean, it's in a way an obvious point, but it's a very profound point. And, of course, in structures and services, it didn't hold and didn't stand. And I was, in the 1990s, I used to travel frequently to Palestine. And worked on health, and it was very interesting because it was the time when the Ministry of Health was just coming to Gaza in 1995 and after the Oslo Accords. And there was a very strong tension at the time between the more community health-oriented work of the Union of Palestinian Medical Relief Committees, the health work committees, the sort of more ground-up, factionalized, but ground-up, community health-centered approach, versus an approach which seemed to be build more hospitals, build more clinics, and have people come to them. And I'm just wondering how this is relevant now in Gaza, because it seems that the latter approach very much won out from what I understand. I'm out of touch, but it seems that the latter approach was more dominant. And how does this, how is this relevant to what's happening now in Gaza? I'd just like to end by an apology that I have to go to another meeting at 1, so that's why I was very eager to ask my question. Thank you.
Yeah, I'll take one by one. Okay. So it's incredibly important, and this is something. So another part of my work, so the work that I'm doing at the Birzeit, is actually looking at precisely the history that you just alluded to around social movements and how they develop, but also all the tensions that kind of occurred over time and how the trajectories of the history of Palestinian health was determined. So that question is a really, really important one. I'm unfortunately yet to go to Gaza, and so I really want to kind of try to understand the culture from talking to people more than anything else. But there is something that you can sense as a difference, and maybe you can support or refute that based on your observations from your time in Palestine. That there is a qualitative difference between how people actually saw health services between the West Bank and Gaza, in that there was much more almost like natural acceptance and insistence on the role of kind of community-based interventions and primary healthcare in Gaza compared to the West Bank. There are lots of different forces at play. There's the fact that Gaza hosts a much larger proportion of a refugee population, which was served from very early days with primary healthcare services from the UN Relief and Work Agency, whereas in the West Bank, there was still all of these kind of elitist urban structures. There was kind of less rupture, shall we say, also in 1948 between in the West Bank compared to Gaza. So in Gaza, that kind of the rupture also kind of paved way for other more nascent ideas such as community-focused healthcare or continuity healthcare. So I think there are these things to try to understand in the culture, and I also gained insights from your paper, Martin, and the others around those community structures in Gaza, which actually, from everything that I've read and heard, look very different also in Gaza. So I think part of what we're talking about in terms of not just kind of the resilience of healthcare services, which of course, nothing in the world can take the amount of bombardment that Gaza has taken. No structure can continue standing. but there are still sparks of spirit here and there that continue and persist and actually still rise up. And I wonder, I always wonder if it's to do with that kind of actually much more rooted culture around the importance of community. And you see that also in the way that people talk about healthcare professionals who've been martyred, who've been abducted, in how close they were actually to the communities that they were serving. So it's clearly such an important thing to think about in terms of rebuilding, and in terms of also how we organize these kind of infrastructures for the struggle and for resistance that we talked about. So no answers, but just more thoughts.
Thank you, Layth. Other questions? Yes.
Thank you for this wonderful presentation, both of you, even though I'm close to the Institute, but you always learn from these presentations. My question to you, Layth, extends in a different way, but with the same spirit as Jocelyn. You talk about, let's say we are talking about health facilities, so we have decided we're talking about hospitals, etc. But then the hospitals have health personnel which are many different scope, not only the physicians. And we nowhere do we hear about the nurses, but the emergency room staff. And I think this is something that is important to look at. I made the comment in the conference that when we watch on TV the hospitals, we find people bringing the wounded to the hospital, and the ambulance drivers had a big role. And I was asking about Difaa al-Madani. I mean, is this? I asked Rita, my friend, in the beginning. I said, "Who are all these people? Nobody's wearing uniforms. You know, we are used to the Difaa al-Madani. At least we're wearing a jacket that this is Difaa al-Madani, but we didn't see that. They were just coming in, carrying people. And again, I don't know, the hospitals operate with so many people inside. People slept in the hospitals, so I don't know whether this is also going to be part of what was the context of the hospital during the war, because it was outside, inside, mixed all together, and yet everybody seemed to know what they're doing and where things are going and things like that. So if you could give us a bit of a varied look at the hospital than only physicians and you know, but also the community that was there. Thank you. This may be too much, but it really was, for us watching, it was really amazing to look at these hospitals, and how they collaborated.
Absolutely. Actually, near the beginning of the genocide, I remember writing an article in which I was trying to kind of think through what this state of exception, what these spaces of exception represent, and what resistance to them looks like. And that same day when I was writing my conclusion, I was just on social media, saw someone in a tent going to another tent and taking donuts that they had baked for someone to celebrate their birthday. And I put that example as like a structure that resists death in Gaza, because for me, I was equally struck, like you, by the fact that these people who seemed not to have any official affiliation with hospitals, participating in the care, participating in bringing people to hospital. Ghassan talks about the man he saw as they were approaching Salah ad-Din, as Ghassan was evacuating from the north to the south, who was on a wheelchair. And he told him, I can't help you either in Ahli or Shifa, but I'm going today to Deir al-Balah. If you can find me, I can't remember where he said it was, but maybe can't remember exactly, but somewhere in Deir al-Balah, then maybe we'll have something there that I can tend to your son's wounds in. And this man, Ghassan was surprised to see the next day, had managed to wheel his son in a wheelchair across all of these destroyed roads, in the middle of all of these snipers that had manned the entirety of Salah ad-Din Street running from north to south, and brought him to hospital. So, you know, he's as much as part of the health system as anyone else. by being able to do that. And so I think it's certainly really, really important, and we're trying to kind of find ways to capture those different, whether they're kind of the smallest thing where it's literally just someone holding an IV bag or bringing a patient in, or trying to bring joy to someone on their birthday by reaffirming life in that way. But also all of the various professions and the way in which they're incredibly agile at navigating that entire system. And yeah, trying to find different ways. So on an individual level, we're certainly documenting as much as we can, not just martyrs who were doctors, but also the stories of all the other professions, all the victims from all the other professions. So that's one. But on the broader point on how these structures actually fit together, what these hospitals looked like, we're still trying to figure it out. And I'd love suggestions. But one of the things we kind of thought is talking, and trying to get testimonies from people like Hassan or other people, other doctors and nurses and first aid responders, et cetera, to try to essentially paint the picture of a day, through their eyes, and trying to look around and try to convey what they saw, and then try to, once we know what they observed, maybe we can try to put that picture together into how those systems came to be the way that they are, that there were real participants from across the entirety of society within the healthcare sector, within hospitals. But I also would love kind of suggestions from you, but also anyone else who has them, about how we can try to convey that and understand it and unpack it, for sure.
Thank you. Yeah.
My voice is loud enough. Okay. I'm just worried about the books in the library. Are they all digitized? Do you have a plan to, because IPS has been attacked in the past. Inshallah ma bisir shi, but you never know.
Thank you for this question. Actually, we have lots of the books and private papers and posters digitized and backed up to a large extent, if I may say. I just want to add that Ghassan Abu Sitti is the supervisor of the health documentation project, and we really want to thank him for this. Despite all that he passed through and all of his occupations, he has been generous enough to be part of this project as well.
Absolutely.
And thank you for this amazing event. Martin, thank you so much.
I just want to pick up on Huda's question, maybe to wrap up a bit. I think one important element of resilience and the ability of the health sector in general to continue to work despite everything, and the one that is worth documenting is the role of journalists also in actually voicing out what's happening in Gaza and documenting and bringing the truth to the surface despite all the silencing and the so I think we've mentioned this in our paper. The first responders in terms of community, regular or ordinary Gazans who actually stood up and helped others, and the journalists along with other community health workers all the way to people in hospitals. So that's one comment. The other thing is that I think if we want to talk about the health sector in general, of course, we agree that it goes beyond the hospitals and even the primary healthcare facilities or the other health facilities. And it would be important, maybe at a later stage, to include the wider circles affecting health. We're talking about food security, famine issues. We're talking about vaccination records, the whole spectrum of services and of resources that affect the health sector in itself. So I know this is a much bigger endeavor, but maybe it should be also on your radar.
Absolutely. Yeah, definitely. Thank you. And it is, and yeah, I mean, that sounds like another paper that we're going to commission you. So thank you, Martin, in advance.
Do you want to make that announcement we talked about before we wrap up?
Yeah. So yeah, I mean, so actually, as part of this, I mentioned the policy papers. We are always looking for, we are constantly commissioning kind of proactively, but also very open to suggestions about policy papers and other forms of analytical writing that we can be hosting and commissioning. So please, we welcome kind of any suggestions, any proposals, any discussions about that. And we also, always need assistance with getting reviews of those papers once we receive them. So kind of a peer review kind of process, which we would very gladly receive any volunteers for, or anyone who's willing to give us suggestions about how we can, whether it's kind of with the topics that we commission, or with the things that should be within the papers themselves once we receive them. So if anyone is happy to participate with us, we are very, very happy to receive you and have you on board. So please get in touch. That's my email, or you can get in touch with Rami or Martin, and she can pass on your details, whether online or in this room. So yeah, please.
All right. Thank you very much. Thank you everyone for attending. Thank you, Rami and Layth, for a very insightful talk today, and good luck with everything you do, and hopefully we'll find more ways to collaborate together. Thank you.